My name's Leticia, and I'm a fourth-year medical student from UofL. I'm here to talk to you today about asthma and how to best manage your disease and prevent flare-ups. So what is asthma? Asthma is a disease that affects your lungs, causing irritation and inflammation in the areas that surround your airway, making it more difficult for you to breathe. It's a common disease in both children and adults and can have a major impact on your health. Asthma runs in families and is more common in patients who experience allergies, eczema, or live in an area with significant air pollution. Symptoms of asthma include coughing, wheezing, shortness of breath, and chest tightness or pain. Nighttime cough can also be a sign of asthma, although it can represent other medical problems as well. If you have these symptoms or you're concerned about having undiagnosed asthma, talk to your doctor about getting tested. You may be sent to get a test called a pulmonary function test, which reports how well your lungs are working in response to certain triggers and treatments. The severity and frequency of asthma symptoms can vary depending on what triggers your illness and how well controlled your disease is. Once you're diagnosed with asthma, your doctor will start you on a daily inhaler that can help prevent asthma flare-ups where your symptoms get worse. They will also prescribe inhaler medications to be used in the event of an asthma attack, where you experience rapid onset of coughing and difficulty breathing. It's important to follow all treatment recommendations provided by your doctor, as they can help reduce the risk of severe exacerbations and even death. The best way to prevent severe complications of asthma is to be prepared, and that includes using your inhalers as prescribed and keeping them with you at all times. According to the Asthma and Allergy Foundation of America, 1 in 13 people in the United States suffers with asthma. This number accounts for about 7% of adults and 8% of children, and these numbers have been consistently rising for the last 30 years. Asthma is also the third most common cause of hospitalizations in children under the age of 15. Over 3,000 patients a year die from asthma exacerbations, which is extremely significant for a disease for which we have adequate treatment. It's important to follow your doctor's treatment recommendations and maintain good asthma control to avoid the types of severe exacerbations that can lead to hospitalization or even death. It's also important to seek medical attention immediately if you are experiencing an asthma attack that does not improve with the use of your inhaler. You can never be too careful when it comes to getting treatment for your asthma. When you're diagnosed with asthma, your doctor will prescribe medications to help control your disease and keep your airways working well. What medications you are prescribed and how often you use them will vary depending on how often you're experiencing symptoms. Ask your doctor about setting up an asthma action plan to help keep track of what medications you should use depending on your symptoms. This action plan will include green, yellow, and red zones that indicate what medications to use based on how severe your symptoms are and what your peak flow meter reads. Maintenance medications should be taken daily. They work to decrease the irritation and inflammations in your lungs, which helps prevent your body from having an exaggerated response to things that trigger your asthma. They must be taken every day to effectively control your disease. If you have a history of allergies, it's also important to take a daily allergy medication to reduce its impact on your asthma. Your doctor will also prescribe medications to be used in the event of an asthma flare. You should only use these medications when you're experiencing worsening symptoms. If you use these medications and your symptoms do not improve, it's important to seek medical care. If you find yourself using your albuterol inhaler more frequently, it may be helpful to keep a symptom diary. This should include how often you're having daytime symptoms, how often you're experiencing symptoms at night, and how often you're requiring additional doses of your inhalers to control your symptoms. Your doctor can look over this information and determine whether you need additional maintenance medications to help improve your symptoms and achieve better disease control. Another important part of controlling your asthma is knowing how to use your inhaler properly. Your doctor will prescribe a metered dose inhaler that contains medications to help open up your lungs, and they may also prescribe a spacer to be used with it. If you or your children are given a spacer with your inhaler, it's important to use these two things together to achieve the best results. The following video explains more.
Using a metered dose inhaler with a spacer. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your pointer finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back a little bit. Press down on the inhaler one time and breathe in slowly and deeply. Breathe in all of the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly.
A peak flow meter is a device that is used to measure how well your lungs bring in oxygen. Peak flow is the maximum rate you can breathe out after a maximum breath in. During an asthma attack, your lungs tighten up, which limits how well air can move in and out of your lungs and decreases your peak flow. To use a peak flow meter to measure your asthma, you have to know what your baseline peak flow is. This can vary based on age, height, gender, and body size, so it is a different number for every person. It's important to record a baseline peak flow measurement when you are breathing normally and not experiencing any asthma symptoms. It's also important to use a peak flow meter correctly in order to get an accurate measurement. The following video explains how to use a peak flow meter.
How to use a peak flow meter. Slide the marker or arrow on the peak flow meter to the bottom of the numbered scale. Stand up straight. Take a deep breath. Put the mouthpiece of the peak flow meter into your mouth, tongue down. Close your lips tightly around the mouthpiece. In one breath, blow out as hard and as quickly as possible, like you are blowing out candles on a birthday cake. The marker should move along the numbered scale. Note the number in your peak flow diary. Thank you for viewing this video from the
After you've established your baseline, you can use a peak flow meter to measure how well your asthma is controlled. It's important to check peak flow regularly, and is especially important if you feel like your symptoms are getting worse. The asthma action plan we discussed outlines green, yellow, and red zones that can guide you to adequately treating your asthma based on your peak flow. In the green zone, your asthma is well controlled. You aren't limited by your asthma, and you can go about your normal routine without experiencing symptoms. When you measure your peak flow, it reads at 80 to 100% of your baseline peak flow value. Although you are experiencing good control of your disease in this zone, it's incredibly important to keep taking your daily asthma medications in order to prevent an asthma flare. In the yellow zone, you're starting to experience more symptoms of your disease. Your symptoms are starting to affect your day-to-day life. When you use your peak flow meter, it reads at 50 to 75% of your baseline peak flow value. In this zone, you should add your flare-up medication to your daily control medications. After using your flare-up medication, monitor your symptoms to make sure they improve. You enter the red zone if you are having a lot of trouble breathing, your flare-up medications did not help your symptoms, or you have been in the yellow zone for 24 hours without improvement. Your peak flow meter will measure less than 50% of your normal value in this zone. It's important to take any additional flare-up medications outlined in your asthma action plan and contact your doctor immediately. If you cannot reach them, you should go to the emergency room. Now that we've discussed how to monitor your symptoms and follow your asthma action plan based on what category your symptoms fall into, we need to discuss asthma triggers that may lead to a flare-up. Common triggers include allergens, illness, air pollution, stress, and exercise. If you have a history of allergies, allergy testing can help identify specific triggers such as mold or pet hair that can make your asthma worse. Exercise is an important part of keeping your body healthy. If you experience more asthma symptoms after exercise, you can try using your inhaler 15 to 30 minutes beforehand. Cigarette smoke is also a very common trigger for asthma. Smoking increases the inflammation in your lungs just like asthma does, so it can have significant impacts on your health and your ability to control your asthma. If you or someone in your household smokes, it's important to talk to your doctor about smoking cessation. Illness is another very common cause of asthma exacerbations. It's important to follow your doctor's guidance regarding illness prevention, including getting a flu shot every year, regular hand washing, and avoiding interacting with others during times like these when the coronavirus poses a significant risk for patients with asthma. Air pollution can also be an often unrecognized cause of asthma exacerbations. This is a common cause of triggers in large cities, and Louisville actually ranks number 7 on the American Asthma and Allergy Foundation's list of 100 worst cities for asthma exacerbations. This makes it even more important for Louisville residents to keep up with their asthma action plan, take daily medications, monitor their peak flow, and seek medical attention if symptoms are worsening. If you're unsure of what makes your asthma symptoms worse, it might be helpful to start a symptom journal to record what you were doing before you started having difficulty breathing. This can help you and your doctor look for triggers and figure out how to best control your disease.